Hello, Mr. Jones. My name is Brenda and I will be your father's nurse today. I see that your father has Alzheimer's and may not be able to answer my questions. Will you be willing to answer a few questions for me right now?
No, I have been in the emergency room for 10 hours and I am going home now. Just tie him to the bed. That is what I would do if I were you. Otherwise he will fall out and hit his head and then I will be mad.
I understand that the admission process can take some time, but to keep your father safe I need some information from you. Are you saying he falls at home frequently?
Yes, that is why we have an air mattress next to his bed so that if he falls he will not hit his head and bleed all over.
Well, okay then. Have you noticed a change in his behavior, such as being combative, confused, or impaired judgment?
You know he has Alzheimer's, right? He has all of that.
I understand that. However, there are different stages of Alzheimer's and we want to make sure that we have an accurate understanding of your father's condition. For those of you watching this video clip, the patient does not have hypotension or hypovolemia. Is your father able to control his bladder and bowels, or does he wear briefs?
My dad has to wear briefs because he does not know when he needs to use the bathroom. Are you done yet? I want to go home.
Does your dad drink any alcohol?
Only 2 beers a day. But do not worry, if you give 2 beers at bedtime along with his sleeping pills you will not hear from him the rest of the night.
For those of you who are sitting here in orientation, the patient is not a post-operative patient, but his medications do cause sedation.
Oh, did I mention he has his medical marijuana card? I brought in his special little pipe and his bud.
Now those of you in the audience may be thinking, what am I supposed to do with that? You can tell the family to take it home with them or we will give it to the police. When Mr. Jones is discharged they can pick it up from them. We do not have a license to distribute. Does your father have any assistive devices such as the walker or a cane to get around safely?
Yes, he has a walker. He is 110 years old. He is very unsteady on his feet, so we put bubble wrap on his elbows and knees for when he falls. We also spent the extra money and bought him a helmet so he does not hit his head and get any crazier.
It is important for you to understand that your dad is at a very high risk for falling while in the hospital. We want to keep him safe. Can you or one of your family members stay with him to help keep him safe?
Seriously? We were not keeping him safe at home. Nobody can stay. You will have to have someone sit with him.
We will do our best to keep your dad from falling. Here is a form I need you to sign stating you understand that your dad is at risk for falling while in the hospital.
Those of you in the audience, make sure the signed paper gets in the chart.